Hey y'all, welcome back. I'm Mama Dr. Jones, a board certified ObGyn and mom to four, and today we are talking about Abelina Sabrina's video that she recently posted about a pregnancy that almost killed her. Sabrina is a video content creator. She is on Twitch, she live streams, she does commentary and politics, and she also has a YouTube channel. You all have sent me this video so many times since she published it, and I really wanted to go through it with you, but I didn't want to do it without getting a little bit of input from her. So at the end of this video, I'm going to hop on a call with her and we're going to just chat, just going over how she's doing now since she uploaded the video and if she has any regrets about talking about this so publicly. If you're new here and you'd like to subscribe, I would love to have you. We talk about all things pregnancy, gynecology, periods, and everything in between. I promise you will leave with things to tell your friends. First off, I apologize if the audio in this video is a little bit echoey. I am filming this from an Airbnb and there is a lot of echo in this room. It's actually an old gas station that's been renovated and it's really, really cute, but it's right on a major road. There's lots of car noise and it doesn't have like any soundproofing. So we're gonna do the best we can.
So years ago, I found out that I was pregnant and I did not want to be. I was not ready for that. And as soon as I confirmed it at home, I made a doctor's appointment and I went immediately just to get a second confirmation and just find out where to go from there. Even though we're in California, you know, the bluest state probably in the whole country, you still have to go through quite a few hoops to terminate a pregnancy, and it's scary. And even at the first doctor's appointment, I think it didn't fully set in what was happening. They had to refer me out to Planned Parenthood because Kaiser Permanente refused to do it, which is wild.
This is something I talked about a little bit in the Texas abortion law video, but this is a problem. A lot of hospital systems will have a system-wide rule that you cannot do elective terminations in any of their facilities. So I am guessing that this is probably the reason why she had trouble finding somebody who could provide that care. Now, some people would argue, oh, it's not a big deal, you just go to Planned Parenthood, and in a lot of cases, that's true. However, Planned Parenthood can be very hard to access for some people depending on where you are, and this causes a problem where your care is disjointed. So she's seen this person, they took care of her at the clinic, and now she is going to a new provider. In a simple situation, that's not that big of a deal, but if there's any complications or anything out of the ordinary, sometimes this causes a breakdown in care, and it's definitely problematic for the patient.
So they referred me out to Planned Parenthood. I, made the appointment there. I went, and they couldn't see anything, which was weird because I was certainly far enough along for something to be seen, and they couldn't see anything. So they thought, well, maybe you're not as far along as we thought. Come back in 2 weeks or something.
This is a problematic part of the story, in my opinion, because if someone comes in and they should be far enough along that you should be able to see something, it's very true that sometimes they just ovulated late, they're not as far along as they thought they were, and it's just too early to see anything. However, it also is possible that this means that the pregnancy is somewhere besides inside the uterus. And so coming back in 2 weeks is the right answer, along with a HCG level, which is the hormone level, on that day, and then again 48 hours later. And what that does is let us look at the trend. If a pregnancy is a normal, viable pregnancy, or even just in the right place, generally it's going to have a trend of doubling every 48 hours. If that level is about the same or goes down just slightly, then you're concerned this is either a non-viable pregnancy, which will end in miscarriage, or this could be an ectopic pregnancy. So at that point, you can offer treatment for ectopic pregnancy if there's nothing in the uterus and you have what we call plateauing or just not appropriately rising beta HCG levels. I don't want to comment on if that's definitely the only correct way to manage this, but personally, that is how I would have managed this.
Especially when most of the medical workers that you've been interacting with have been telling you things like, are you sure you want to do this? You have to be 100% sure. If you're even 99% sure, we're not going to let you do this. So it sticks with you a little bit. I always knew that I had to end it, but it's just harder when you're getting a lot of opposing pressure pressure to not do it from medical staff and honestly your own body. It's so weird. Like once you get those hormones in your body, there's like this instinct that kicks in that makes you want to protect it, even though your brain is like, no, we're not ready for this. This was always the plan. If this happened, you promised your boyfriend that we would do this. So it was really scary to be receiving all this conflicting pressure from medical staff and your body to not do it, and then being pressured by your partner to do it.
What she's saying is that she felt like the medical staff was pressuring her away from an abortion. And when I talked to her on the phone, she went through this a little bit and said, since then I've talked to some other people and realized that what they were doing was confirming that I was not being coerced into this decision. And she reiterated over and over, this is what I wanted to do. But when I started thinking about the medical staff saying these things to me and interpreting it as they didn't think this was the right decision, it gave me pause because I didn't understand why. And then she talks about the boyfriend who's trying to convince her that she has to do it. And all of these are not appropriate. Now, it is important that the medical staff question to ensure that she is not being coerced. And this is generally done away from any family members or friends. And that is important. That's an important part of the process to confirm there is no coercion and that this is being made on that person's own accord. However, that should be explained to the patient. I'm asking you this not because I'm questioning your decision, but because I need to confirm that it is your decision and nobody else's. Have you been convinced by somebody else that this is what you should do, or do you feel you're being coerced? And that is usually sufficient because when someone is alone, they typically will open up about that if they feel like they need to. I just want to be very clear here that it's not appropriate to try to convince someone to have an abortion, and it's not appropriate to try to convince someone not to. It is only appropriate to have a neutral discussion with them and support what they need.
And I did have moments of weakness where I would cry and say things like, okay, but honestly, like, can we just consider, like, what if we didn't do it? Still gonna do it, but can we just consider what would happen if I didn't? He would say, like, no, it's not even a question. You're gonna ruin my life if you do that. That would be the worst thing to ever happen to me. As along the lines of things that he would say. And at one point, he even said that he would break up with me if I didn't do it, and that he would resent me and the potential child.
This is incredibly toxic and manipulative. I don't ever really know how to address this. I'm sure that when people do this, it is from a place of fear within themselves and worry within themselves, but it is not okay. This is abusive and manipulative and coercive. Importantly, somebody can know for sure that they want to make a decision and still need to go through the process of verbally playing out all the options. Because going down those paths, especially with someone you trust who's going through this process with you, is important to our psyche to confirm how we will feel with each outcome. So going down the path of discussing, okay, what will we feel like if we have the abortion? What will I feel like if I choose to terminate this pregnancy? What will I feel like if I choose to keep this pregnancy? What will you feel like if I choose to keep this pregnancy? Playing out scenarios in your head of different options that you have in life is a very normal and important process of decision making. And it doesn't mean you aren't sure what you want to do. It just means that's your brain confirming, and that's okay. And you should be supported in that. And you should never have that held over your head as, oh, you didn't actually want to do it, you were questioning your decision. No, you're playing out scenarios because this is a normal part of brain function and cognitive development about decision making. It's normal.
And then I just kept having pain and bleeding, and nobody took me seriously. And then one morning, I woke up at about 4 a.m. to the most intense pain I've ever felt in my life in my lower left abdomen. And it was so sharp and painful. I went to the bathroom because, I'm all of a sudden I'm bleeding a lot, which can't be normal. And I couldn't even stand up because the pain was just so intense. I went to the doctor multiple times. And one of the first times I went, the lady was just like, well, just take some Tylenol. Go home. What do you want me to do? And then I went again later that day because I was still having so much pain. and they said, oh, you're probably miscarrying. Go bleed it out at home.
So this appears to be pain that she has, which is starting 11 days. I zoomed in on the note and on her visits, 11 days after she was diagnosed with what we call a pregnancy of unknown location, meaning you have a pregnancy and it could be somewhere it doesn't belong, like a fallopian tube or on the ovary, or it could be an early pregnancy in the uterus and it's just too early to see it. That's a pregnancy of unknown location. And this should be urgently followed up to ensure that you do not miss an ectopic pregnancy. In fact, now that she has bleeding and pain, along with a pregnancy of unknown location, which is documented in her medical note, although interestingly, she very clearly went in for pain. She was seen twice in the same day. The ER note doesn't even mention pain. They just talk about vaginal bleeding. That should have been ectopic pregnancy until proven otherwise. This is backseat medicine. I have hindsight of knowing now what the outcome is going to be, but I'm concerned. I don't like this management.
Over the course of the next few days, I'm just taking medicine to manage the pain, which is constant, and I'm still bleeding a lot. My appetite is weird. Even eating something as small as a grape caused so much pain, so I wasn't really eating. But my stomach was growing a lot. For the span of a few days, my stomach probably expanded from here to here. And it didn't make sense. And I would call the advice nurse and they would say, oh, you're probably gassy.
What she's describing here is very obviously a rupturing ectopic pregnancy. The bloating is from blood being inside the pelvic and abdominal cavity. Even a small amount of blood that's not enough internal bleeding to kill you or make you feel bad can cause severe pain and really bad bloating. Your guts, intestines, and the lining of the abdominal wall and all of the organs in there don't like to be around blood. Blood goes in your veins and arteries and not inside your pelvis or abdominal cavity. Just a tiny bit to cause severe pain and what she's describing here with the bleeding. With the bloating.
And you know what? It's just so frustrating too, because I know at multiple visits I did request imaging and I never got it. Not like the imaging where they go on top of the tummy, because that's not in depth. I asked for more intensive imaging, where they actually go in, and they wouldn't do it. And I really wish that they would have.
If she's saying she never had a vaginal ultrasound, I am appalled. And even if she's just saying they didn't repeat the vaginal ultrasound in the emergency room when she came in with new pain, new bleeding, and a pregnancy of unknown location, that is terrible. 100% I would have done a vaginal ultrasound on somebody who had pain, had bleeding, had been to the clinic earlier in the day, already had a pregnancy of unknown. I can't wrap my head around this. She should have had a vaginal ultrasound, in my opinion. Again, I don't want this to become me saying these doctors mismanaged her, but this is not the way that I would have chosen to manage in this scenario. Again, I have hindsight of knowing the outcome, but that outcome is what you're trying to prevent, and every OBGYN should be actively doing that. So this is 5 days after her last visit to the ER. I don't know if this was, like I was talking about earlier, a problem of having seen so many different people that nobody knows the full timeline of the story, or if this is just a problem of terrible care. But I'm sorry, Sabrina, that the medical system didn't listen to you and failed you. And this is such a common thing that I see you sharing your stories about, not just Sabrina, but a lot of other people not being listened to by the medical system. And I want to add here that I should never have to teach you how to advocate for yourself. That should just be a given, that medical professionals listen to you. But I can't fix everybody, and I can give you some tools to empower yourself to speak up. And if you are being seen and you don't feel you are being listened to, it is always okay to voice that. I don't feel like I'm being listened to. I am concerned about XYZ. Even if you don't know what it is, I'm concerned because I am having pain and it is not normal.
And then all of a sudden, the weirdest painful sensation came over me again. But this time, it made me really dizzy and faint, and my heart was just racing, and I had this pain in my lower abdomen. I just knew something was wrong. And so I left work early. I called my boyfriend and I told him something's wrong. I'm going to the hospital again. I don't feel well. Something is wrong. And he said, okay, well, I have work to do and it involves other people, and then we're going to go out and get dinner and drinks with them.
What the hell? Who does that? That is horrible.
So I had to go to the hospital alone. And I was there for about 4 hours by myself. Finally, I'm getting the in-depth ultrasound. And if you guys know anything about ultrasounds, you know that the techs are not allowed to tell you your diagnosis at all. You have to hear it from a doctor. The ultrasound tech is in there, and she seems confused by something. So she gets another tech's input. I don't know if it's like her manager or just another person. And then the other tech goes, yeah, that's her uterus. And then the original tech says, no, that's her uterus. And I'm just laying there like, what are you talking about? What's happening? And they wouldn't tell me anything.
Okay, so from the perspective of the tech, I'm sure what they wanted was just another set of eyes on the images, because an ultrasound tech, their job is to get good images of all the structures so that the radiologist can look through them without actually being in the room with the patient and read out what the imaging says, where everything is, what's going on. So their job is to be really good at getting good images, label them well, etc. It's always okay as a tech or as anyone, I do lots of ultrasounds, to get a second set of eyes on the images. But what you should not do is not tell the patient why you're doing that. So in this scenario, a better way to have handled this would have been to tell her, I can't quite see all the structures that I want to see, and I want to make sure that we get good images so we don't have to repeat this, invasive exam. I'm going to grab one other ultrasound tech to help me make sure that I'm getting good images. And then the ultrasound tech, shouldn't have said that in an alarming way. You say, oh, that's their uterus. And then the other tech says, no, actually, I think the uterus is here. I'll just get pictures of both so that radiology can actually see what's going on. What they probably were looking at is a blood clot or a collection of blood or the rupturing ectopic next to the uterus. It can look a little odd and sometimes hard to kind of decipher what you're looking at.
Finally, it seems like boyfriend is on his way, so that's nice. And he comes right in time to get the diagnosis. I had an ectopic pregnancy in my left fallopian tube. It ruptured. I've been bleeding internally ever since. They were surprised I wasn't dead, and that if I don't have surgery right then and there, I was going to die for sure. And as an added bonus, the surgery might not go well, and I might die during that too. So here, sign these waivers and paperwork, because you don't have a choice anymore.
She's accurately describing the scenario. So what an ectopic pregnancy is a pregnancy that occurs anywhere it's not supposed to be, meaning outside of the uterus. The most common place for an ectopic pregnancy to occur is in the fallopian tube, because that's where fertilization occurs. And if it gets stuck, the embryo gets stuck on the way because of scarring or just luck, bad luck, obviously, or because the tube is unusually small for some reason, just anything, any number of things that hold up the embryo in the tube, it can implant in the tube. It grows to a point where you have significant pain most of the time, and then it breaks open and bleeding is significant. The blood flow to the fallopian tube and all parts of the reproductive system in pregnancy is very high, and you can have bleeding that is very, very swift and can kill you very quickly. And the thing that a lot of times people don't understand, even sometimes people who are not in my specialty will not understand that most of our patients who get pregnant are young and relatively healthy, and their bodies compensate really, really well. Their vitals look fine, they look fine, but they're saying, I have severe pain, their labs look fine, and then all of a sudden they crash. They go from normal cognitive functioning, normal vital signs, normal talking, just having pain, to acutely in danger of dying quickly. And so this should be taken very seriously, and it's why we try to prevent this from getting to the point that she's describing that hers was at.
They went in there with the little laparoscopic surgery, and yeah, my entire left fallopian tube exploded, so I don't have that anymore. She was able to save my ovaries, so that's nice. They're just kind of like stuck onto the actual uterus, so I still have them for like hormone purposes. I can't use them. So there go half my ovaries.
So I talk about this in the call with her if you want to hang around to hear the medical discussion of that, but that's not quite true. And it's actually really interesting that the other fallopian tube can pick up an ovulation from the opposite ovary. So we talk about that in our phone call in a minute.
This thing has changed my life so much. I am not the same person I used to be. My hormones after that rupture were just all over the place, and I would just have lots of random moments of just being thrown into that feeling of what it felt to be just dying all over again at random. I had no control over it, and the only person I could really lean on was my boyfriend, because I couldn't tell anybody.
It sounds like this was understandably an incredibly traumatic experience for her, and she goes on to describe here how she has gotten therapy and that she's been able to open up about this with some of her family and friends, and that's been really helpful. But I think this really goes to show that a misdiagnosis and a life-threatening situation paired with a lack of social support and not feeling supported or heard by your medical team is a setup for trauma. Makes total sense that after this process, she is taking a while to heal completely. And I hope that she is getting the help and support that she needs.
Don't have a fallopian tube anymore. I got dismissed multiple times by multiple doctors. I was refused when I asked for imaging. And the thing is, if we would have caught this sooner, when it comes to ectopic pregnancies, there is a shot that you can have that will terminate the pregnancy, and then you won't have a ruptured fallopian tube. But I didn't get to have that. I didn't even know what an ectopic pregnancy was. Nobody has ever taught me that. Nobody tells you how often even a miscarriage is likely to happen. Yeah, the education system really failed us.
So methotrexate, what she's describing, is actually a chemotherapeutic agent that can be used for treatment of an ectopic pregnancy, and the way she describes it is accurate. If this had been caught before it was rupturing earlier on by tracking HCG levels or by just putting the pieces together sooner with all of the visits she had before this happened, it prevents, in a lot of cases, these life-threatening situations. And we use it a lot. It's standard, and you always want it to be early enough when you diagnose an ectopic pregnancy that you can do that. Other side of that, what she's discussing, education, is quite literally why I exist here. I want to teach y'all about things that go on with your body, how to empower yourself, how to help get your voice heard. Again, that shouldn't be on you, but unfortunately, that is where we are, and maybe that can make a difference, empowering you to have that knowledge, to understand a little more, and to be able to speak up for yourself. So let's go hop on a call with her, see how she's doing, answer some questions if we can, and just check in. Well, hello. Nice to meet you.
Hi. Nice to meet you.
Thank you for letting me use some of your footage. And I know this, it seems to be a very heavy subject for you still. And I want to just first start off by validating that this is always a really difficult topic to talk about, but especially when it comes with both being in the public eye and a lot of trauma that it sounds like, stuck around from going through something like that. So do you have any questions for me or anything that you wanted me to make sure is included?
You know what? I've actually since learned, after I put out that video, I got to talk with somebody who works as kind of like, I don't know what the proper term is, but like an abortion advocate, like somebody who helps and counsels people who have abortions. And I actually learned, because at the time when I went to Planned Parenthood, because that's oddly enough where I received the most pressure not to not do it, or at least that's how it felt at the time. And, that's where everybody was asking me. And like, one, I was really distraught that like my boyfriend at the time couldn't go past like the lobby with me. I was alone. And then every step of the way they were asking me like, are you 100% sure? And I thought that was them like maybe coming from like a personal pro-life thing. But I now understand that they ask you that to make sure you're not being coerced into it. And I didn't understand that at the time. So if anything, I just felt more conflicted. But yeah, anyway, that was just something that I've learned since that I appreciate now.
That's a really great point. And, it's really important to neutrally counsel people, but because coercion, and you even touched on this a little bit too, saying that you knew you wanted a termination and
Yes.
that was already decided, but that having no ability to talk through the different paths of outcomes was really difficult and actually made you more confused and more stressed. And I think that's a really valid point, that you can be 100% sure in a decision that you want to do and you still want to play out like, well, what if I did this?
And I appreciate that, because that's one of the reasons why, most people are really kind and supportive since that video came out, but the people who are not are using that as a way to try to like invalidate me after that thing came out. Just like, oh, well, she changed her mind after she promised she would get an abortion. Of course he should leave her. It's like, I never changed my mind. I was always going to do it. I was just scared of being pressured into it, but I was always going to do it. Like if Planned Parenthood didn't see an empty uterus, I would have done it right then and there, but they didn't let me.
I mean, it just seems like you were completely lacking in support from all angles, from your medical team to your friends and family. So I'm sorry.
Mm-hmm. Thank you. It's getting better. Therapy has helped so much since then.
That was going to be my next question, is how are we doing now?
I'm doing a lot better. I'm less anxious. I feel better about myself. Better than before. I'm not 100% back to normal. I don't know if I'll ever get to that, but certainly better than I've been the last few years.
I will put this in the terms that sometimes put for actually people who experience unwanted pregnancy loss. When you go through something that's traumatic, and almost dying from a ruptured ectopic, it's definitely traumatic. You basically never go back to normal, and that's okay. You learn to live your life in before, where life was kind of this happy bubble and bad things don't happen, to where you've been presented with this life-altering moment where something bad did happen and something even worse was, on the brink of happening, and your bubble is popped and you can't put it back together, but you can learn how to move forward from that. And so hopefully therapy and, being able to hopefully surround yourself with people who are a bit more supportive is helpful for that. It was really brave of you to put this on the internet. How do you feel after publishing that video? Do you feel like that was the right thing to do?
I am. I have no regrets publishing the video. I tried doing it all the right way, where I wanted to make it about my own experience, because this has drastically changed my life. And I mean, women's reproductive rights are a constant issue. And so I was hoping that maybe this could help other uterus owners out there. And it seems like at least it did, because people don't really talk about pregnancy issues as much unless they're involved in them actively or maybe after the fact. But something that like I learned after releasing that video is that these issues happen all the time and nobody wants to talk about it. And I don't blame them, because, everybody's going to deal with their trauma their own way, and that's fine. You don't have to always vocalize it if you don't want to. But it was really heartbreaking reading all the comments from other people who had like pregnancy loss or ectopic ruptures, or their pain was brushed off by their healthcare providers. And it's so common. That was the hard part. Like, I had to have an emergency therapy session because like I want to give all these people the time of day, and I couldn't. And it was just breaking my heart even more.
I think you sharing your story is really important. And I cannot imagine how overwhelming it is to hear all of these other stories and want to really connect with people. But just know that, I've been sent your video so many times, like people send it to me. And I think that generally and genuinely it's helping people. And you're right that sometimes people don't want to talk about things that are traumatic because it's traumatic, but a lot of times they don't talk about it because they don't think they're allowed to. And I think you having a big platform and, being a little bit in the public eye quite a bit, now people, like I saw news articles writing about your video and stuff, like you just kind of owning that situation and saying, I'm allowed to talk about this. This is my story, is an important display of letting people do what they feel is best for them.
Yeah, for the longest time, I felt like I couldn't talk about it. And all the reasons that I could think of why I wasn't talking about it were external reasons. Like they weren't like my own reasons. Like if I did have the choice, then I would have talked about it. I would have talked about it sooner. But I felt like I couldn't, and so it finally felt like, well, it's been about 3 years. This thing is still affecting my life. I'm gonna talk about it, and I hope that it does help other people. I mean, selfishly, I just wanted to get my own story off my chest, but also I'm very, very grateful that it has helped other people.
It's definitely okay to just selfishly want to share your story because it's cathartic or therapeutic for you, and that's important also. Real quick, I do want to touch on, I have a little model here, because at the end you were worried about losing 50% of your eggs, and I'll put this in the video, but not this part. I'll actually make a good video. But most models that we see of a uterus are inaccurate, but this one is kind of accurate, although it's like a cheap Amazon thing. The ovaries here, I don't know if you can see it, but they're not actually attached to the fallopian tube. So when you have, it's falling apart. When you have a tube removed, they cut this out, that leave that here. It would seem like, okay, that side can't work anymore. But actually your body is pretty magnificent. What happens when the uterus is sitting inside the pelvis is that the fallopian tubes and the ovaries both kind of sit back here. So you can actually ovulate on that side that has no tube, and it can still get picked up by this fallopian tube. So although your fertility does very slightly decline if you lose a tube, it is not half. So you should feel good about the fact that that ovary still has a job, that if you decide that you ever would like to get pregnant, you probably will be just fine.
Does the egg just kind of like float around until it gets swept into the other side?
Yeah, so a little bit, yeah. They sit pretty close together, and what happens in when you're nearing the time of ovulation is that your body makes these substances called cytokines, and they are like local chemoattractants, basically. So they attract the fallopian tubes to be like the fembria of the fallopian tubes to be closer to the ovary. And so the egg is ovulated, and ideally pretty quickly after that, because it's open into the abdomen at that point, it gets picked up by the tube or it dissolves. They kind of just go away if they don't get picked up. But yeah, the tube is attracted to the ovary when it's ovulating. And so it's weird. It's kind of weird to think about, but it just kind of draws them in so that they can pick up the egg if they want. So, the reason, there's a lot of reasons we know all of that, but we track people's ovulation, and you can see the side that they ovulated on. And you can see sometimes that people will ovulate on the right ovary and end up with an ectopic in the left tube. And that is, a weird thing. But so if they took your whole tube out, you shouldn't be a lot at an increased risk of another ectopic. A little bit, but not a lot. And the most likely scenario, if you ever decide to get pregnant, is that you'll be just fine. And, if you need fertility help, there are lots of options, but I wouldn't make that one of the things that you stress about just yet.
Can I ask, after having an ectopic, why is the risk increased to have another? Is it just because we don't know the reason that it happened? And
so, if it's just a random event, then it probably is not actually increased, but a lot of times we don't know. So we know there are things that slightly increase the risk of an ectopic. It could be anything from the shape or size of somebody's fallopian tube, like the lumen of the tube, or any scarring, or, just very slight abnormal development in the tube. It depends what caused it. Usually, if somebody has an ectopic, they don't have another one. I certainly have seen it happen, and it is a slight increase in your risk from baseline, but most of the time it doesn't happen. Next time, if you ever get pregnant again, or you decide that you want to, I would highly encourage you to find a doctor who will get early lab work for you and do this, 48 hours apart, because even though your risk is low, it will make you feel better if you ever get pregnant again or want to be pregnant again, or even if you're pregnant and you don't want to be pregnant again, to see that number double, because that signifies that it's probably in the right place.
Yeah, that's definitely the goal. If I ever become pregnant again, I plan to keep an eye on it.
Although it should not be that I'm sitting here teaching people, speak up until you're listened to. It should be that you're just listened to. I can't change the entire medical system, but I can tell people, and if you are hurting, just keep talking about it until somebody helps you.
Do you also recommend, as I've heard, like if you are trying to advocate for yourself and you're getting brushed off, like say you want to request like imaging or labs, how do you feel about patients who insist that the denial of that request gets written in their charts? Is that okay, or is that too demanding?
Oh, absolutely. I mean, so for me, the thing is that, and I may have a big head, but I don't think I would ever have a patient who felt the need to do that. Because if somebody's, saying, I really want an ultrasound and I think it's, not worth the money or whatever, I'm going to go through the process of explaining to them, here's the reasons why we shouldn't pay for this, because if this is the outcome, it doesn't change what we're doing versus if this is the outcome. And so if someone at that point, after we go through it and they want me to put that in their chart, absolutely, because I'm always going to have medical reasoning behind that. And I would hope that my patients would just work with me so that we can make sure we get the right choice of a test. So if you're in a situation where you feel like the person taking care of you is not explaining to you the reason why whatever you think needs to be done isn't being done, then don't ever hesitate to tell them to document that. And you can keep a note yourself as well that just writes down, like, I asked for this, they refused, they wouldn't tell me why, or they gave this reason that I don't agree with. And that's always okay.
Okay. Yeah, that's a piece of advice that I've been hearing since the video came out. And I have one last question. Is it true that, I feel like IUDs are a very popular method of birth control lately. Is it true that you are more likely to have an ectopic pregnancy in the rare event that you do get pregnant while you have an IUD inside?
So yes, but this always comes down to a little bit of a confusing discussion. The risk of an ectopic when you have an IUD is higher if you get pregnant. But the risk of pregnancy is so incredibly low that the risk of an ectopic is significantly lower with an IUD in than it is if you don't have an IUD in. Does that make sense?
Okay. Yes, it does. I think that's all my questions.
Thank you for chatting with me, and thank you for sharing your story.
Thank you.
You're welcome. I hope that you learned something today. If you're new here and you'd like to subscribe, hit that subscribe button, turn on notifications so you never miss an upload. Leave a like on this video if you liked it or if you learned something, and go follow Sabrina on her channel as well. Thanks for being here today, y'all. I will see you next Monday.